Hello, everyone, and welcome. We're here today to shed some light on a crucial topic in medicine: mechanical ventilation. It's something many of us have heard about, especially in recent times, but perhaps don't fully understand. Joining us today is the creator of Medical Mindware, who's going to walk us through the essentials. Thank you for being here.
My pleasure. Happy to be here to help clarify this important area for everyone.
Excellent. Now, for many in our audience, hearing that someone is on a ventilator immediately signals a very serious, even critical situation. It can be quite frightening, evoking a lot of concern. Could you help us understand why that is? And then, from that starting point, explain what exactly is mechanical ventilation? And why do doctors and nurses even use it in such challenging times?
That's a great question, and it's the perfect place to start. Imagine, if you will, someone who is really, truly struggling to breathe. Perhaps their lungs are incredibly tired after battling a severe infection, like a tough case of pneumonia, something we've seen a lot of, haven't we? Or maybe they've been through a major surgery and their body simply can't manage the hard work of breathing on its own. For instance, if their GCS, or Glasgow Coma Scale, score is very low, meaning their brain can't properly control their breathing. In these critical moments, that's where a mechanical ventilator comes into play. Think of it, quite simply, as a special machine that acts like a temporary set of lungs, providing that vital help to keep the person breathing. It's a lifeline, really.
A temporary set of lungs? That's a powerful image. So, how does this machine actually do that? What's the basic mechanism behind it for our audience to grasp?
Absolutely. Let's make it super clear and really easy to picture. Think of it like this. You know how a bicycle pump works, right? When you push the handle down, air gets forced into the tire. Well, a ventilator does something very similar for your lungs. At its core, it's quite simple and incredibly impressive. First, it gently pushes air. Now, normal air, the air we're all breathing right now, has about 21% oxygen. But for a patient needing a ventilator, we often mix in extra oxygen, making it much more concentrated than what's naturally in the atmosphere. This oxygen-rich air is delivered directly into the patient's lungs. Imagine it as a consistent, gentle breeze, almost like steadily filling up a balloon. Then, just as smoothly, it helps that air, now full of the waste gas, carbon dioxide, come out of the lungs. Sometimes it's a natural release, like letting air out of a balloon. And sometimes the machine even actively assists in drawing it out. So, the whole purpose, the truly life-saving, impressive part, is to make sure the body constantly gets enough of that precious oxygen it desperately needs, and just as importantly, efficiently gets rid of that harmful carbon dioxide. It's a critical, perfectly timed exchange that the machine handles when the patient's body just can't manage it alone anymore.
That sounds like a heavy load off the patient's body. So, beyond just assisting breathing, what's the big goal of this therapy?
The main goal is precisely that, to give your lungs a break and keep your body stable. Think of your lungs like a pair of bellows, constantly working to pull air in and push it out. But sometimes these bellows get very tired or damaged. When they can't do their job well enough, mechanical ventilation steps in. This breathing break buys crucial time for the doctors to treat the original problem that made your lungs sick. For example, if you have a severe lung infection, the ventilator helps you breathe while the doctors give you medicine to fight that infection. It's like putting a broken leg in a cast. The cast doesn't heal the bone, but it stabilizes it so the body can heal itself.
That's mean it's not just about the machine itself, then. Is there more to this whole setup?
Absolutely. That's a vital point. When we say ventilator, we often mean just the main machine. But it's actually part of a whole ventilator system, much like an engine is just one part of a car. To make mechanical ventilation work effectively, you need several essential parts all working together seamlessly. Gas supplies, like big tanks of oxygen and medical air that feed the entire system.
Electrical power. It needs electricity to run, just like any complex piece of technology.
The ventilator machine. This is the main unit, the brain and the pump that controls the breathing. Breathing circuit. These are the special tubes that connect the ventilator to the patient, delivering air in and collecting it back out. Artificial airway is often a tube placed directly into the patient's windpipe, trachea, to ensure air gets into the lungs efficiently. The patient's lungs, and of course, the ultimate target of all this support. The entire system is designed to help them function. So, the ventilator machine is just one very important piece in this entire system, all working in harmony to help someone breathe.
This sounds incredibly powerful, but also like a tremendous responsibility. What are the major risks and challenges involved in managing mechanical ventilation?
You've hit on a critical point. While it's an amazing, life-saving machine, using it is one of the most challenging and serious jobs in a hospital for several reasons. First thing is that it's very complex and needs constant expert care. Running a ventilator is not really simple. It takes specialized knowledge beyond what a regular doctor or nurse learns. Think of it like flying a complex airplane. You need specific training for that exact plane. The medical team has to constantly watch, adjust, and make important decisions about the ventilator's settings and the patient's breathing strategy. This makes it extremely labor-intensive and requires continuous, hands-on work around the clock.
Thank you so much for shedding such vital light on mechanical ventilation today. It's truly clear this is an incredibly powerful tool that demands immense skill, constant attention, and highly specialized knowledge from the medical team. And speaking of that crucial specialized knowledge, it's evident from our discussion that we've only just scratched the surface. To truly build a complete understanding of mechanical ventilation, we know there's so much more to explore. So, for our audience, we're excited to announce that in our upcoming video lessons, we'll be diving much deeper into both the technical intricacies of the ventilator machine itself and the vital clinical application strategies that doctors and nurses use every day. We believe these next episodes will provide even more clarity and practical knowledge to empower your understanding. Before we sign off, a quick request. If you found this discussion helpful, please subscribe to our channel and hit that bell icon so you don't miss our new uploads. Also, we'd love to hear from you in the comments below. Your suggestions on the content we're creating are invaluable and really encourage us as we prepare our next videos. Thank you again for joining us.